The concerns I have, of course, is that delaying medical or surgical treatment while taking these natural or traditional herbs or procedures could worsen a woman's fertility prospects. 3 in 10 women have fibroids, but no one warns you how they could affect your fertility. It's not just about having heavy periods or that having fibroids is not normal. And is your doctor telling you everything that you need to know about fibroids and fertility? If you've always heard that women with fibroids cannot get pregnant, or because you have fibroids, they will steal your chance to conceive, and you've been looking for how to solve these problems, this video is for you. Hi, I'm Dr. Sylvia, a GP and women's health specialist. Today on AskAwayHealth, we are going to be clearing up all the confusion, addressing the myths, with evidence-based answers to questions around fibroids and fertility. Looking at questions like, can fibroids cause miscarriage? Whether you should remove them before you have IVF? And can you get pregnant if you have fibroids? We're going to break down these myths and explain your options. This video isn't scaremongering. In fact, think about it as a roadmap to the options you have with fibroids when it comes to fertility and pregnancy. Fibroids are benign growths that develop from the muscle of the womb. We believe they grow under the influence of hormones like estrogen and progesterone. But there's a lot more to it than just hormones, and we don't know everything about fibroids and how they develop and grow. Fibroids can cause a variety of symptoms, but the majority of women with fibroids do not have symptoms. You may have 1 or 2 symptoms of fibroids like heavy menstrual bleeding or pelvic pain, but you may not experience other symptoms like back pain, leg pain, or bladder problems, for example. So let's start with the biggest question. Can you get pregnant if you have fibroids? This directly affects the first myth, which is having fibroids means you can't get pregnant. This is not true. Most fibroids, especially the ones we call subserous or small intramural ones, don't interfere with your ability to get pregnant. Most women with fibroids conceive naturally, depending on the size and location of the fibroids. I don't know how this myth came about, but perhaps it's the high prevalence of fibroids in some areas that fuels the belief that the presence of fibroids always blocks pregnancy. It doesn't. The next myth I've got to address is that having surgery to remove fibroids, that is a myomectomy, will always damage the womb and cause infertility. This myth in particular is a problem because believing this myth actually leads to fewer women accepting surgery for fibroids because of the fear of complications like infertility. Please don't get me wrong, myomectomy surgery is a very important and significant medical operation. It can carry risks. However, modern myomectomy techniques, for example, laparoscopic surgery or hysteroscopic surgery, preserve the womb as much as possible. So when this surgery is done by competent hands and in reputable facilities, these fibroid removal surgeries actually increase the chance of pregnancy for a significant number of women who otherwise would have really struggled to get pregnant without having the operation done. This is a good place for me to state that fibroids can return after surgery. So pregnancy is encouraged within 12 to 18 months after your surgery and recovery from the surgery to make the most of that fertile window before the fibroids grow back again. The next myth is that fibroids always cause miscarriages. How true is that? Well, actually, it's not completely true. While the submucosal fibroids, which can extend inside the inner womb cavity, may increase the risk of miscarriage, most women with fibroids carry pregnancy to full term with proper monitoring. So there is a small risk, depending on the type of fibroid. But it's less likely to happen, especially if you have fibroids that lie outside of the womb cavity, as many of them do. Next myth is that you need to remove all the fibroids you have before trying to get pregnant. No, you don't. Women can carry pregnancy successfully with fibroids. In fact, some women with fibroids do not even realize they have fibroids, and they experience no challenges getting pregnant or carrying their babies and delivering their babies naturally. The fact is that only fibroids which can distort the womb cavity itself or that block the fallopian tubes actually require to be removed. Having surgery that you do not need can increase the risk of developing scars on the womb, and that itself can lead to infertility and challenges getting pregnant. So please be careful of offers to have surgery like myomectomy, not because it's not an effective treatment, but I think you should get a second or even third opinion to be sure it's definitely what you need to manage your symptoms or if it's contributing to any fertility issues. Not every woman with fibroids needs to have surgery. Regular monitoring with scans is enough if you do not have fibroid symptoms. Okay, let's move on. Have you heard of this one? IVF won't work for you if you have fibroids. No, having fibroids doesn't limit you from having IVF. There are many reasons for infertility in women. Fibroids contribute a very small percentage. If it's thought that fibroids are causing a significant impact on your fertility, then of course, surgery is one of the treatment options that will be offered. One of the other options is medication to shrink the fibroids. Otherwise, the IVF success can depend on the location of the fibroid. Having submucosal fibroids can reduce the success rate of IVF by perhaps a third or about 30%. But we think that intramural or subserosal fibroids have minimal impact on IVF success rates. The next myth I have concerns about is that traditional herbs or rituals can shrink fibroids and restore fertility. So I've heard a lot of comments from people who feel surgery and hormone medications are bad for women and prefer natural or traditional treatments like herbs or womb cleansing rituals. However, we don't have a herbal remedy or treatment that shrinks fibroids away. Some may assist with symptom control, and they can be combined with other measures to give you the best possible outcome. But the problem with simply accepting this myth is that delaying medical treatment while taking these herbal treatments or going through these natural or traditional rituals could worsen fertility prospects for a woman, because remember that fertility reduces with age. I think it's something worth thinking about and discussing with a medical practitioner that you trust. So we've had a look at certain myths and beliefs around pregnancy and fertility when it comes to fibroids. I know this conversation will give you hope because you realize that there are many treatment options available and you should not be afraid that fibroids can limit your chance of getting pregnant. In summary, fibroids do not routinely prevent pregnancy. Location matters. Submucosal fibroids that enter within the womb cavity can be most harmful to pregnancy or fertility. In addition, treatment options vary. Myomectomy preserves fertility, not reducing it. Hysterectomy, that is removal of the womb, is only ever considered as a last resort if you finished having your children and if the symptoms of fibroids are so much that we can't control them with any other means. Pregnancy is possible following a myomectomy, and it's recommended within the first few months after you recover from the surgery before the fibroids get a chance to regrow. Please consult a fertility specialist who is an expert in fibroid care to give you advice about your own personal situation. Don't just believe half understood ideas or myths when it comes to fibroids, fertility, and pregnancy. Thank you so much for watching. Check out this video right here where I have lots more useful information that will help you make the right decisions about your health and fibroids. Don't forget to give this video a like and of course subscribe to the channel. Let me know what you think in the comment section below and I will see you again very soon.